Welcome back to another report of the injuries going on in the NFL with a little bit of a deeper dive into a select injury. So today our deep dive is going to be looking at the ACL injury suffered by Stefon Diggs as well as several other players who have torn their ACLs. But as always, let's talk about briefly some other players that you may want to pay attention to, whether it's for your favorite team going into this week or in regards to your fantasy team. So a few weeks ago, we talked about Mike Evans and his hamstring injury. Great news, he is expecting to play this Sunday. It's been about 5-ish weeks, which if you go back to our deep dive on his injury, we were saying that it might take 4 to 6 weeks, depending on the severity of the injury. So he is on track to play after suffering an aggravation of his right hamstring in week 7. CeeDee Lamb, we initially talked about him, I think it was last week actually, about his AC injury. And he's now back on the injury report, however, with something different. He is on the injury report and was limited with back and foot injuries, but he's still likely to play. And that's good news for Dallas because they need something right now. And apparently Cooper Rush / Trey Lance, he needs to help them out because Dallas cannot get anything going right now. So good news for Dallas, Lamb should play. Devontae Smith and Jalen Hurts are both on the injury report for the NFC East rivals of the Cowboys, the Eagles there. Smith still dealing with that hamstring injury, but he suited up and played the last 2 games regardless. So he's expected to play, and Hurts suffered an ankle injury in the Thursday night win over the Commanders, but he is going through what they call a light protocol, and he is expected to still play this week. Now, moving on to the 49ers, both George Kittle and Brock Purdy are on their injury report. Purdy, let's start with him. He is listed with some shoulder soreness, but Shanahan said that it's not likely that he's going to miss the game. So he should play, which is good news for our 49ers team, which is struggling right now. And George Kittle declared himself that he will play. So I'm always about confidence, but we'll see if Shanahan or anything else happens in this week that might hold him back for another week, or he may be good to go, which is another pass-catching threat for the 49ers, which is awesome. Isaiah Pacheco, who fractured his fibula earlier in the season, was placed on IR, has been practicing in a limited fashion. Andy Reid is non-committal as to whether or not he's going to play. Pacheco is still considered on IR currently, and they have not activated him to the roster. But that's something to keep an eye on, as Kareem Hunt has been playing very well in Pacheco's stead. But it'll be interesting to see if Pacheco does play, if they work him back in slowly, or if they allow some type of committee to occur between Hunt and Pacheco. So if you have either Pacheco or Hunt, that's definitely something to keep an eye on. And if you have Pacheco and he does play, I would say wait to kind of see what happens this week to see how they ease him back in or if they go with a committee approach. Those are the more notable names that are popping up on the injury report this week. Let's get into the deep dive. And like I said, we're going to be talking about an ACL injury or anterior cruciate ligament, which Stefon Diggs tore a couple of weeks ago, the wide receiver for the Texans. But also Brandon Ayuk, I believe, injured his ACL. And it's a very common injury, not only in football, but other sports as well. So if you're not familiar with it, the ACL is a ligament, one of the 4 main ligaments that we commonly think of in your knee. And what it's primarily used for is providing stability in that knee. So it prevents your femur or tibia moving too far on the other bone, respectively, in the knee joint. So if we're looking right here, this is the front of your knee. If you're sitting in a chair, for example, so your knee is bent, and right here is that anterior cruciate ligament, that ACL. It prevents your tibia from moving too far forward on the femur, and conversely, it prevents your femur from moving too far backwards on the tibia. Typically, this is torn through a multitude of different ways, but more commonly than not, it's related to some type of hyperextension, or your foot is planted and that you're pivoting or cutting in some way, shape, or fashion, and your foot gets stuck or you're turning too far. But regardless of how it happens, that tibia or femur moves too far in their respective direction on the other bone, and that ligament can't sustain the stability of that knee and ends up tearing. Now, typically, because we hear so often of ACL tears in sports and athletes, it requires surgery. It is possible to not require surgery if it is partially torn. Some non-surgical treatments are certainly viable, PT being one of them. or if they are not experiencing severe instability of the joint and they have no intention of playing any other contact sport or high-level activity, then they may not have surgery. But we're talking about athletes here. So if it is fully torn, they're likely going to have surgery so that they can continue to play. Now, the reason why an ACL injury or any cruciate ligament in the knee injury is so severe and is considered potentially career-ending, or they may not be the same athlete that they were a person when they come back onto the field, is because ligaments take a very long time to heal. They don't have as much blood supply as a muscle, for example. So not only do they take a long time to heal, but once you tear the ACL once, it's more likely then that you tear the other one, right? So there's always that compensation that ends up occurring that we need to make sure as healthcare professionals that we minimize that as much as possible so that the athlete continues to be healthy and doesn't continue to suffer these injuries. Now, involved with the ACL is what we commonly look at to see if there's any other structural injuries to, for example, what we call the terrible triad. That involves the ACL, the MCL, and the medial meniscus. And the reason why that's the terrible triad is because they all share some type of common attachment / overlap. And so what can end up happening is that if one ends up being injured, it's likely that one, if not both of the others, are also injured. And then obviously that complicates the recovery, and it's more likely to then require surgery as well. For the ACL surgery itself, touching very briefly on it, the way that they take the graft to find a new ligament is they'll either take it from a cadaver or they'll take it from the athlete or patient themselves. Commonly, you'll take it from the IT band, your patellar tendon, or your hamstring. Sometimes they will use, for example, a ligament from a pig or a cow, but it's more commonly that they use it from a cadaver, a human cadaver, or the patient themselves. From a recovery standpoint, overall, you're looking at somewhere around 10 to 12 months, if not a little bit longer. You're going to start out initially by just letting that ligament heal and then allowing that range of motion to improve, doing some strengthening initially, and then moving to walking and light jogging, usually somewhere around 3 to 5 months, and then slowly integrating sports-related activities. And if you're moving along very, very quickly and the recovery is going well with no setbacks, at the earliest, you might get back around 9 months, 8 to 9 months, maybe 10, depending on the sport, right? Any sport that has a lot of cutting, planting, change of direction, pivoting, then it's just going to take a little bit longer because it demands more stability of that knee. And then more also dynamic stability of the musculature surrounding that knee to continue to protect it. For a lot of athletes, especially professional athletes, they don't actually feel confident on that knee until somewhere around 18 to 24 months after their surgery. And part of that is just because of the level that they're competing at, and they are just so explosive, so strong, and are making such important and decisive and split-second decisions and movements that the workload and stress that's being placed on that knee and the ligament and the muscle surrounding that knee is just significantly higher. So that's kind of the path of recovery for an ACL injury. Thankfully, over the years, the techniques for surgery have gotten much better, and our understanding of sports medicine and recovery has also gotten better. So before, when it used to be well over 12 months for a ACL tear, now we are able to say like somewhere around that 10-month mark, it is possible to get back. And the one who kind of first initially did that, at least in recent memory, is Adrian Peterson, where he came back in around 10 to 12 months, and then almost broke the NFL single season rushing record. So couldn't talk about this and not talk about AP, but that is kind of a quick little synopsis of an ACL injury. So unfortunately, Diggs, as well as several other players in the NFL, have a long road to recovery, but it is something that is unfortunately common in professional sports and sports at any level. But the good thing about that is that we know how to move forward with it and how to treat it and help our patients to the best of our ability. So I appreciate you guys listening, and if there is another injury or player that you want to deep dive into, make sure you put it down in the comments below. I'm always happy to take requests. As always, thanks for watching, subscribing, and clicking that bell. And I'll see you guys in the next one.